My name is Humaira Ahmed. My student ID N41388038. Module name Contemporary Issue. I'll be talking about the vast economic implication of COVID-19 pandemic in the UK's health and social care system today. The pandemic was not just a public health crisis, but also a major economic downturn with consequences on our healthcare service and were and remain acute. The paper will discuss several important issues related to the topic. First, economic shock wave impact on healthcare funding will be addressed. After that, we will explore the actual consequences of the four service provisions and how policymaker, healthcare professional and patients saw this. I will then conclude by offering some possible ways to address the continued issue and increase the health system resilience to further crisis. NIH 2024 research brought the forward the interlink between the healthcare outcome and the economic factors, which I will use for the presentation. So we will begin with the initial economic crisis. The first economic shock. When the UK was in the early month of pandemic, economic activity sharply dropped, pushing down tax revenues and leaving the UK's financial strength. But because NHS funding had to be relocated to emergency responses, routine care has been badly distributed, elective surgeries were delayed, as were exciting problem in healthcare infrastructure because of a shift in funding. Staffing shortage also became a section problem and further weakened service capacity below as they were by balancing public health priorities which economic stability policymakers exposed as they did weakness in the healthcare system's resilience. But these changes have yet to have the full financial impact, which is why comprehensive policy reform is required to become long-term sustainable. Impact of healthcare funding. But the pandemic prompted significant financial investment of healthcare in the UK at a cost. Large budget deficit gave rise to fear about the long-term financial sustainability. Austerity measures were used to control this deficit, which with the further draining of healthcare funding. This caused many patients to have worsened health outcomes from many non-urgent treatments that were postponed. Moving forward, we need to find new ways to fund healthcare service, such as public-private partnerships so that health insurance remains well funded during a tumultuous time in economic context after a pandemic. Service privileges distribution. The pandemic exposed significant weakness in healthcare service provision. Routine care and elective procedures were withheld in favor of treating COVID-19 pandemic when hospitals took precedence. The backlogs persist today. Especially the mental health service were hit with resources being divided and many left without essential care. In addition, productivity of the NHS diminished as workloads increased and staff numbers decreased. They emphasized the necessity for sustained reforms of the long-term healthcare domain, including workforce planning and livelier healthcare infrastructure in preparation for further crises. Stakeholder prescription government response. They took the various actions to tackle the economic and health issue, including increasing NHS funding and the furlough schemes. Central London, however, would not always be fast enough or efficient enough. Different regions were affected by the inconsistency of coordination between national and local government. This meant the policymaker had a difficult balancing act between recovery of the economy and provisions of healthcare service, focusing on the further and more decentralized procedure of handling crisis would enhance both response time and supply of resources, making healthcare emergencies more prepared for the future. Stakeholder representing healthcare providers. Being healthcare provider during the pandemic was going to be a hard thing I would have faced. High quality care was becoming increasingly difficult to maintain with burnout and mental exhaustion due to increasing inpatient number and such. Together with this, many frontline workers were left unemployed. Staff shortage worsened without sufficient government support. They were forward will be in investing in retaining the workforce, improving wages, and venturing into mental health programs to prevent recurrence of situation like this. If we do not support our healthcare provider, the system can become long-term unstable. Stakeholder participation and public prosecution. The pandemic was very hard on patients' lives. Some were forced to wait longer for routine treatment and their health conditions started to deteriorate. The elderly in particular struggled most as they were dependent on necessary care in time, only increasing uncertainty and fear. The government communication was inconsistent. As access to the NHS became less, this caused a loss of public confidence in the service. Therefore, in order to rebuild trust, policymakers have to give transparency and fairness a priority and deal with the inequalities that grew worse during this crisis. Of equal importance is to ensure that patients feel heard and valued in the process and promoted health relations healthcare system. Policy recommendation, funding and investment. Funding at strategic level is critical of if we wish to have a resilient healthcare system. In the realm of digital healthcare, investing will make things more efficient and preventing from happening will alleviate long-term costs. In contrast with where they continuing using emergency funding to establishing their economy in crisis. Financial planners should prepare themselves on the way they can plan in a manner that will minimize chance of further instability. Expand workforce is also necessary. Without enough staff, the healthcare sector will not improve, as we have witnessed gaps that are incredible several in this pandemic. But if we do not take protective measures now, we will fail to be prepared for the next health crisis. Policy recommendations, service delivery improvement. To strategic healthcare delivery, we need to change the structure of healthcare system. A quicker response during crisis, however, could be a good reason to dentalize decision making to relieve in hospital pressure. Expansion of community-based care must take places. It brought the urgent need for stronger mental health service, with a lot of people suffering in silence due to resource shortage. Unless we follow the lesson here, we will run into the same distribution tomorrow. Today, investment in these areas will make in a system that is somewhat more malleable, the patient-centered, and able to survive coming health challenges. Policy recommendation, workforces, rotation, and well-being. At the same time, our healthcare workers have been overstretched on top of being underpaid. The maintaining the skilled professional competitive wages are needed. Reduction of burnout will be driven by non-pay issues such as improving working conditions and supporting employees' mental health. Too many workers quit the field under the unbearable stress that This cannot continue. Investing in professional development not only improves the job satisfaction but also ensures better quality of care patients receive. If we wish to keep a functioning healthcare system, workforce well-being must be a main concern. Conclusion. Finally, although the changes have come about on a global scale due to the pandemic, they are a sign that the system has been fundamentally exposed to vulnerable that need to be addressed. Government support helps service to stabilize, but that a long-term solution is required to be resilient in the upcoming crisis. Sustainable funding, policy reform, and workforce investment are to be prioritized. Turning a blind eye may lead us to mistakes we have made before. As a nation at large, such a stronger and better prepared healthcare systems address the interest of not just providers and patients, but also the nation at large. Thus, the lesson learned must be guiding to us toward healthier and fairer healthcare further. Thank you.